It's really been a pleasure to listen and hear all the comments coming from countries, because that's what we do such a poor job at in many, many situations. But I'd like to start by just paraphrasing and summarizing what I believe Chikwe said, and he can correct me as we go along if I'm wrong. But what I believe I heard Chikwe say is that what we really need to do is get the balance right between global, national, regional, and local levels. We need to get that balance right in some way. And at the same time, we need to do a better job of listening to what is needed by countries and what they want and feel they need. And this latter point really was driven home to me recently when I participated as a facilitator in a course on vaccines. It was for Africa. It was given out of Ghana, but it was Africa-wide with public health leaders. And it's a course that I participate in each year with the National University of Singapore and the London School of Hygiene and Tropical Medicine. This course teaches application of vaccines, and at the end of the course, there was a poll. And the poll was, what is the priority vaccine for use in your countries? And this was actually last November. And at that point, in fact, almost all participants said malaria vaccine is our priority. And when asked why COVID-19 vaccines weren't a priority, there were several responses. One was a graph that had been done in Senegal, which showed the antibody level of COVID-19 was already above 90% in most areas in Senegal. And the second was a comment that I won't forget, which was from one who said, you know, he said, our populations perceive vaccination for COVID-19 as a means of the North protecting themselves by vaccinating us. And so I think we really have to be careful as to what we say globally. And this was right at the time when WHO continued that we need to get vaccines throughout the world to 70% of the population. So it was really driven home to me at that time that we really need to listen better. And today I've been able to listen quite a bit and really have understood much of what's going on in countries. But to come back to how do we ensure that we get the balance right, I think we've already made great progress, really. The International Health Regulations in 1969 were an attempt to stop disease at borders by such measures as vaccination if you were coming from a country with yellow fever. By 2005 or 2003, it was understood that this really wasn't the way to go. And the revision in 2005 did two things. Number one, it placed the requirement on countries to develop the capacity to detect and respond where and when diseases are occurring in order to save lives in their own countries, but even more importantly, globally, to prevent the international spread of these infections. And at the same time, it provided a safety net where countries were to work together if indeed there was an outbreak, so that they could help the countries stop the outbreaks. So the IHR made a step forward, but unfortunately, after 2005, we saw what happened was that many governments didn't engage in providing or in developing these capacities. And at the same time, the donor community did not engage in providing at least matching funds to countries to do the job of developing their core capacities. And so we're left now with a void in this. And I think good evidence of what happened with the IHR 2005 is that countries each year were required to provide to WHO a report of their progress in capacity development. If you look at the map of countries that didn't report in the period after 2005, you'll see that by 2011, there were 3 countries in West Africa that were not reporting, and they were Sierra Leone, Liberia, and Guinea, the countries in which the outbreak took off dramatically. Yet countries that had reported their capacities were interested enough to do that, were Nigeria, Senegal, and Mali. And in those countries, in fact, they were able to stop outbreaks when there were importations. So I think there is some importance in what the WHO does in these reports, and I hope that countries will continue to develop their capacities. We have a possibility to make that occur even more with the treaty which is being negotiated. by WHO on preparedness. But in reading through it recently, I noticed that there's really a lack of one word throughout that, and that is prevention. This is all about being prepared to respond and not going further back, as Chikwe said, to that One Health approach of preventing the spillovers and other activities from beginning. So hopefully that will be rectified in this treaty, but the treaty could really help us get the balance right. It could make sure that at the global level, we're not creating mechanisms to respond to outbreaks. We're creating mechanisms to help countries establish their core capacities and have access to the goods that they need. At the regional and national levels, it's engagement, making sure that countries are engaged and they will, in fact, not only develop the preparedness and the prevention activities that they have, but be willing to share their skills with others. And finally, at the national level, at the subnational level, and at the local level, we need to do a better job, all of us, in listening and in responding to the needs as identified. The decolonization approach that is so important right now. So thanks, Melissa, and back to you.